Well, hello and greetings to all of you. My name is Kelvin Ampofo. I serve as the second district representative of the Omega Psi Phi Fraternity Incorporated. We are elated. We are excited that you have joined us again on this monthly webinar to bring you the facts, bring you the up to date information as it relates to this pandemic that we've been dealing with now for 21 months, COVID 19. I'm asking everyone right now to go and grab the special lady in your life, your wife, your daughters, your aunts, any female in your life, because we have some dynamic presenters that we're going to have tonight. Ladies talking to the ladies. So, fellas, please take the time right now to go grab those ladies. We have a wonderful, wonderful lineup for you on this evening. Let's start off as we always do. As I always say, the guests that you hear, they're going to share their views. So please be mindful that the comments and views expressed by individuals tonight are their own and do not necessarily represent the views of the Omega Psi Phi Fraternity Incorporated or any other entity that the speakers may be affiliated with. Let's start off with our horseman lineup that we already know. Dr. Boykin, he always comes to us, a retired pediatrician, giving us the facts. Dr. Boykin, it's so good to see you. Uh, Also, we have Dr. Jedan Phillips. Again, been with us since the very beginning. Epicenter of New York. Has been in the emergency rooms. Family physician, Dr. Phillips. It's so good to see you. Dr. Boykin, go ahead and start us off with the latest and greatest up to date information, my brother. Good evening to you.
Well, good evening and welcome to our guest. I'm pretty excited tonight about our guest that we're going to have speaking tonight. And I thought I'd do something a little bit differently tonight. I'm going to give you usual statistics, but I'm going to add a little bit of flair for our lady guest, some information that I don't often talk about on these webinars. So, as usual, I'll start out with the current statistics, if you will. COVID cases are over 43 million in the as of 8 o'clock yesterday evening in the United States. And the COVID deaths are over 689,000. Now that's a sobering statistic because right now we've exceeded the statistics for the 1918 flu. They got over it. We have vaccines and we're still in the pandemic. Now the good news is that overall hospitalizations are starting to trend downward, but the hospitalizations are still greater than they were when we had the onset of this particular pandemic, and we have vaccines again. Remember that. In the pediatric world, there are over 5 million cases, cumulative cases of COVID-19, which represents about 16% of all the cases. And in the week ending 9/23 per the AAP, that's the American Academy of Pediatrics, we had about over 200,000 cases of COVID-19 in the pediatric world. Now, again, these are trending downward, with our biggest peak for this particular peak came around September the 2nd, and they're going down now, but we still have an increase in the cases from the preceding 2 weeks of pediatric COVID cases. Now, if you think about that, deaths in the pediatric world is 0.27% of all cases, which is not a whole lot of the cases. But of those 206,000 pediatric cases, only about 0.3% resulted in death. So that's not too bad. But the fact is that the cases of children 11 and under are significantly increasing, and they continue to increase because they cannot be vaccinated. But as we hear later on, hopefully there's some good news on the horizon for that. And I decided tonight to add in some statistics about pregnant women. And of today, 125,250 cumulative cases in pregnant women, and only about 161 deaths in the pregnant population. Now, 22,000 were hospitalized, but only 540 went to the ICU. So that was pretty good. And of those that got the case, they tended to hover around the ages 25 to 29, and it was followed closely by the group ages 30 to 34. And by race, it was mostly Hispanic and non-white Hispanic. White non-Hispanic were the largest groups of those particular statistics in the pregnant women. Now, what about the variants? Well, they continue to be out there, but I want to just take a moment to briefly define how we look at the variants. There are variants of interest, variants of concern, and variants of high concern. And thank God we don't have any, it's a high consequence, VOHC variants of high consequence. And thank God we don't have any of those in the United States. Now, our previous variants, the UK variant, South African, they all been reclassified now according to Greek letters as alpha, beta, and gamma. And in the last week or so, they have been reclassified as variants being monitored because they're no longer being in high circulation, but they deserve monitoring because they continue to wreak havoc in other countries. And let's talk about vaccinations real quick. Overall, a total U.S. population of all ages that have received at least one dose is 64.5%, and fully vaccinated 55.9%. And of those that are 18 and over that have received at least one dose, 77.2%, and fully vaccinated 66.8%. Now, the pediatric statistics, remember, vaccines are only approved for ages 12 to 17 because 18 is when we consider them to be adults. So of those that receive at least one dose, 75.4%, and fully vaccinated 65%. And some good news coming, and I hope one of our colleagues is going to talk about that later on tonight on the 5 to 11-year-olds in terms of vaccination. Now, I want to clarify something real quickly before my time runs out. The booster and the third dose. I think there's some confusion around this. The third dose is just that. Third dose is a dose given to immunocompromised people that may not be able to build the antibodies like everybody else would. So that's considered a third dose and not a booster. And that's right now recommended for the mRNA vaccines such as Pfizer and Moderna. Yes, Moderna can be given right now because it's considered as a third dose in the people that are immunocompromised. So they will be given 28 days after their their second dose. And the booster shot is only approved for individuals for Pfizer only, not Moderna or Johnson & Johnson yet. And that's given 6 months after for specific populations of, people that are over the age of 65, those that live in long-term healthcare facilities, those that have underlying 18 to 50, 64 that have underlying health disorders, and those that work in high-risk situations such as first responders or are residents of high-risk populations like that. So that's what I wanted to qualify real quickly, because people think the booster and the third dose of the vaccine for Moderna are one and the same, but they're not. And last time we'll talk about pregnant people, and they say pregnant people to be politically correct or whatever you want to call it, correct, because of, allow people sexual declaration. So we say pregnant people, but we know at this particular time only females that I know of can get pregnant. So as reported to the CDC, as of 9/18 that are fully vaccinated people in the pregnant population, 10% were fully vaccinated before becoming pregnant, 2.6% were fully vaccinated prior to and during their pregnancy, and 18.4% were during their pregnancy. So by ethnicity, who was fully vaccinated? All races, 31%, blacks, non-Hispanic, 15.6%, Hispanic, 25.3%, Asian, non-Hispanic, 45.7%, and white, 33.8%. So I want to bring those statistics tonight because I think we often neglect the pregnancy population, since we have some great female healthcare workers healthcare providers, coming on the line tonight. I thought I'd add information there. And last, I want to say, please get your flu vaccine because it's time. And I will turn it back over at that time now.
Thank you so much, Dr. Boykin, as always, giving us the facts, hitting us hard. We're going to come back to some Q&A. Also, another horseman that we have with us, Dr. Guyton, 91. Good evening to you, my brother. It's so good to see you, and it's so good. I'm glad that you could join us. I know you're busy. We're going to hear from you shortly. Dr. Phillips, you were at the epicenter, 21 months. Dr. Phillips, you got the floor. School us.
All right. Well, good evening, everyone. Again, it's an honor to be here once again, putting this great, strong information and needed information out there, because we're at a critical point. Let's think about last year, right before Halloween is unfortunately the beginning of what led to our winter surge. So this conversation right now is very, very important, because we do not want a repeat of what has happened in the past, because unfortunately we can't booster ourselves out of this pandemic. The pandemic getting under control is going to come from more people getting vaccinated. Dr. Boykin just spoke on the numbers that we are seeing currently. Now, in my day-to-day existence as a family doctor, what have I been seeing? I'm still seeing the people that are getting hospitalized, the people that are dying, the people that are having more severe outbreaks of COVID. Unfortunately, a high number of them are unvaccinated. In addition to that, some people say, well, we've seen cases occur in people that have been vaccinated. And I have 2 elderly patients that I just became aware of that have gotten COVID, and both of them are doing well. And one of the major reasons that they attribute that they're doing well at this point was because they were previously vaccinated. So again, this is still something that is incredibly important. The vaccine continues to show that it has effectiveness. I personally, Dr. Boykin, I got my flu shot Friday. I got my booster shot because I, being a frontline worker, fall into that category of people that should be considering the Pfizer booster at this time. The other group is individuals over the age of 50 that have comorbidities such as heart disease, diabetes, immunocompromising conditions, or other medical conditions that may put their immune systems in a vulnerable state when it comes to COVID. But again, as I said, we are unfortunately also seeing the non-COVID, COVID-related stuff occurring. I work at Stony Brook University, and our deadline for employees that work directly with patients was on September 27th. And unfortunately, I saw a couple people that I have worked with for more than 5 years leave their job. Now, the good thing at our hospital, 100% of the doctors are vaccinated. It seems that a lot of our medical staff that do direct patient care tend to be in the nursing group, who are unfortunately reluctant to get the vaccination. So again, we are seeing the doctors getting the vaccine. And I think that's really important, as Dr. Boykin mentioned earlier, because again, how does a patient feel that is approaching getting vaccinated and the person that they look to for medical information is not vaccinated? That does not reassure them. So again, that's something that has been prevalent over the past couple of weeks. Another thing that we've seen, because, hey, us, we respond to sting. Over the past week, we have seen, at least in New York State, a jump in vaccination rate amongst African-American and Hispanic individuals. Why is that? Maybe it's because cats need their job. So we have seen that, unfortunately, even though these mandates, for some people, they don't like to be told what to do. They want to do this on their own pace. But unfortunately, folks, this is a pandemic. And the nation, which has been on hold for the majority of 2020 into 2021, is not going to have it again. Now, as Dr. Boykin just alluded to, we do have some good news, y'all. Pfizer has submitted its emergency usage approval for the 5-year-old to 11-year-old group, which again, as we talk about reasons for us to get vaccinated, one of those reasons is if more people are vaccinated, that affords protection to those who are not able to get the vaccine at this time, and for those who have medical conditions or ailments that, even though they're vaccinated, they are still very vulnerable to the virus if they get reinfected with it. Last but not least, y'all, these policy changes that are happening, don't sleep on them, because you may get caught up where you get an emergency room bill. Say you get COVID and have to go into the emergency room and be evaluated. Your insurance company may not be covering you if to the full extent that they might have in the past because you're unvaccinated. That 2-week COVID sick leave that we have been getting throughout the pandemic, if you are not vaccinated, your job may not give you that. And you might have to take your own sick days if you have to be away from work. So again, hey, the only way we're going to get through this, y'all, is we got to get more people vaccinated. We have to continue to wear our masks. We have seen 2 recent studies that have shown that masking, including a surgical mask, makes a substantial improvement in your risk of getting COVID. So unfortunately, one of the things I don't like about where I'm at, Long Island, New York, as I saw the news over the past 24 hours, is that we have in Long Island one of the highest rates of cases in children and school staff. Now, why is that? Unfortunately, we dealing with the stuff like other areas of the country as far as people fighting the masking mandates. And unfortunately, we are seeing with these rise in case numbers in the school-age children and staff that are directly dealing with them, that not wearing a mask makes a big, dangerous difference. So with that, I'm going to yield my time because I'm excited, just as Dr. Boykin alluded to hear my brother, Dr. Guyton, but also to hear our esteemed colleague guests that are joining us this evening. So thank you very much.
Thank you so much, Dr. Phillips. And there's a lot of points there. We're certainly going to come back to a lot of points from Dr. Boykin. We're going to do that as a group discussion with the ladies that we have. So once again, brothers that's watching, I hope you've gone to get the special ladies because they're coming up next, and y'all are going to be blown away. Dr. Guyton from the pharmacy side, my brother, please school us. Good to see you, my brother.
Brother DR, Brother 7888, and all the brothers and everyone out there. It is a great honor to be here tonight. After 21 months of working directly to impact the healthcare in multiple communities around this country, and even some of an Oconus. What I want to have tonight is just a theme, 2 words: misinformation and disinformation. You start with those 2 words, and we start seeing why we are where we are at this point. I want you to pay attention to a sensitive event that happened when it comes to misinformation. YouTube as a platform has restricted any disinformation or misinformation about COVID vaccine and the COVID-19 pandemic. That is an event that many of you didn't pay attention to, but it is an important event because now censorship on misinformation is occurring because of the impact to our communities. Let me start talking about, as Dr. Boykin as well as Dr. Phillips has talked about, we have been in a 21-month fog. Our mental health fatigue is at the maximum capacity for a lot of our healthcare providers, and we're exceeding the capacity in many of our medical centers. As we look at the trends, we're seeing that more of our rural communities, our non-metropolitan communities, are having higher rates of infection and death now with the pandemic. When we first initiated and we had to deal with and run into this fire to save lives, we were running into metropolitan areas such as New York, Detroit, Dallas. We are now running into rural areas in Wyoming, Idaho, Mississippi, and we see that trend again because of the lack of healthcare access and disinformation and misinformation. So as we move forward, let me talk about the communities that are more at risk. Our Black community, right now, we have the lowest rate of vaccination, around 30% of any community. That's white, Hispanic, Black. Only the Native American community may have a lower rate of vaccination than we do. And that is troubling because we are more in a more hurtful situation because of our communities historically not having access to care. Our communities having higher comorbidities that we are impacted by. Our healthcare is really impacted by any type of change in our system. Now, as we look at the last 14 days, as Dr. Phillips is saying, he's seen an increase in vaccination rates in New York. Well, in the last 14 days, only 702,000 African Americans have been vaccinated, 1 vaccine. They got 1 dose. While you compare that to the Hispanic population of 801,000. And we look at the white non-Hispanic population, 208 million. So please tell me, what is the difference between our community and their community getting the vaccine? The rate of disinformation and misinformation, the rate of involvement in our communities. I am still hearing, let me dispel some rumors right now, No, it does not put a computer chip in you. It doesn't track you. You have a computer chip in your pocket every day you pick up your cell phone. No, it does not make you grow a tail. It does not change your DNA. And no, it does not cause sterility, and it does not kill you. It does not cause the vaccine. The vaccine does not kill you as COVID will. You say, why are you bringing that up? People know that. I just spent some time with my family in South Florida, and those are questions I had to answer after almost 21 months of being in this fight and me being where I am. I still have to work with my family to dispel some of those rumors. So believe me, our communities need us. They need this information. Now, let's talk about the FDA. The FDA right now has a very important job. They're reviewing all of the safety and effective data from the Pfizer vaccine. They've suggested that a third of the dose that adults get may and has been proven to be safe and effective. So what does that mean? Over the next 60 days, you're going to have a group of very smart scientists within the FDA review that data, review the entire process, and within the next 60 to 90 days, you may see them award full use of the vaccine. Right now, it's an EUA. We could go out and get it for your kids as soon as they give the right. You can go out and get it for your kid, and it's safe and effective. In the studies, preliminary studies, they found overwhelming protection for the kids. So there is sun on the horizon, but we have just got to get through this fog of the last 21 months and the misinformation and the disinformation. Also, what I want to highlight, and I want to highlight this just to make sure you understand, the business community is not playing. There are discussions for restricting you from flying unless you have a COVID vaccine. There are test cases where they're already attempting this. They're already restricting in New York where you can't go to clubs, you can't go to bars, you can't go to dinner, and you can't go to Broadway shows. So the business community is not going to go back to a shutdown. What it's going to do is separate the vaccinated from the unvaccinated. And they're going to say, you can live your life. You can't patronize us, and we'll take your money, but we won't take yours. They're now saying their businesses have the right to say, no, we don't want your service because you could kill everyone in here. I want you to clearly understand this is not over. The misinformation, disinformation is increasing on a daily basis. If you're not watching TV, you're seeing parents in school board meetings wanting the whole school to burn down before you have my daughter or my child with a diaper on their face. That's how crazy, that's where we are now. That's where we are now. Rather than save your child's life, rather than make them wear a mask, they're wanting the schools to burn down. People, family, if you have kids, let's step up and get to these school board meetings. Let's protect our kids. Let's get them vaccinated. Let's get together and dispel this misinformation. All I can tell you is, as I did, I met my family member where they were. I listened to them talk. I had open-ended questions. I understood where they were coming from. And then I had to really explain to them in their terms, this is why you want to do this. It's your 2-year-old daughter. It's your 5-year-old son. If you're going to live for them, we need to get vaccinated and get vaccinated now. I yield back, Brother DR. Again, thank you again for letting me follow 78 and 88. It's a hard task to do.
We appreciate you, 91. Thank you so much, Dr. Guyton. Brothers, we're at the point now I think we've all been waiting for. We've all been waiting for this moment. And tonight, we're going to just call this Ladies' Night. We have 3 phenomenal, dynamic speakers, presenters that are doctors as well. And they're going to share some things from the female perspective. And then once they get done, we're going to all come together. We're going to have Q&A. So please, if you're on the YouTube, put your questions in the comment section. You're going to get live responses from the doctors. Let me introduce our first doctor for this evening, Dr. Kathy Hardwick. Are you there, Dr. Hardwick?
Yes, I am.
There she is. Good evening.
Good evening.
Let me introduce Dr. Kathy Hardwick to everyone. Ladies and gentlemen, certified by the American Nurses Credentialing Center as a family nurse practitioner. She has worked in pediatrics with asthmatic children, in addition to chemical dependency and adult primary care. Dr. Harwork is an adjunct faculty for the Bachelor of Science in Nursing, as well as the doctoral nursing program at Coppin State. She is the medical director of Belongings Health Services and serves as the associate director of clinical services at Goucher College in Towson, Maryland. She has served as a supply sergeant for the Criminal Investigation Command of the U.S. Army. She received her bachelor's from Morgan State, a second bachelor's from Coppin State, as well as her master's and doctor of nursing. Don't get it twisted. You can see the pink and green in the background. She is also a member of Alpha Kappa Alpha Sorority Incorporated. Dr. Kathy Hardwick. Good evening to you.
Good evening.
Let me also introduce our next speaker for this evening, Dr. Michelle Reed. Dr. Reed, are you with us?
I am here.
All right. Good evening. Dr. Michelle Reed is a board certified family medicine physician, public speaker, and best-selling author. She is the owner and medical director of MS Family Medicine Healthcare, PC, which serves 2 locations, the Garden City, Long Island, and Rosedale, Queens. She also serves as the school district physician for 2 counties. Don't let the red and white fool you. She is a member of Alpha Kappa Alpha Sorority Incorporated. Dr. Reed, good evening to you.
Good evening, and thank you for the invitation.
Absolutely, absolutely. And last and certainly not least, Dr. Yolanda Lewis Ragland. Now, Dr. Ragland is a double board certified physician in both pediatrics and obesity medicine. She's the owner and CEO of Family Fitness and Wellness for Community Health and founder and president of Dr. Yolanda Cares Foundation, her nonprofit organization that focuses on reducing health disparities in at-risk communities. Don't get it twisted. Dr. Yolanda Lewis Ragland is representing the devastating, dynamic divas of Delta Sigma Theta Sorority Incorporated. Dr. Ragland, good evening to you. Just make sure you come off mute so we can hear your lovely voice.
My bad. Sorry.
That's all right.
Thank you for having me. I
Absolutely.
appreciate it.
So now we're gonna get it from the ladies' perspective. Dr. Ragland, let's start off with you. Please talk to us about your thoughts. COVID-19, how it's been, how the ladies have been impacted. What do you want to share with us about COVID-19 from a female's perspective?
So I'm going to start because you have so many of us here that has so much important information to share. So I'll start actually from the pediatric point of view as a mother, a concerned mother, and pediatrician in the community. So COVID has been devastating for all of us, but it's definitely been very difficult for our children, especially in the last few months. So most of you known, I think it was Dr. Boykin that told us that there's been a little bit over 5.5 million cases of COVID, positive COVID cases for children. Well, the problem is this is a 240% increase in just a matter of 2 months. From the month of July to the month of September, we had a 240% increase. And why would that be? Do people want to know? Really, it's because of these new variants, right? So the Delta variant is highly contagious, highly transmissible. He talked about some of the other variants, the alpha, beta, gamma. So you had the alpha variant, which was after the original. Well, the Delta variant is 50% more contagious than the Alpha variant. The Alpha variant was 50% more contagious than the original. So now we have children and adolescents that are being affected. And so we are up 240%. So this is devastating because as a parent, now what we thought our kids, when we thought our kids were immune or at least less likely, they're much more likely to be infected by the Delta variant. And now what has happened? School has started. So we're being affected by school closures, positive cases, and our children can't be vaccinated just yet. As most of you know, Pfizer has done a study, and that study was for the 5 to 11-year-old. And the great news about this was many people are concerned about the vaccine in young people and young children. Well, what they did for that study is the normal dosage for an adult is 30 micrograms. Well, what they did was they did a study for children 5 to 11 with only 10 micrograms, and they found it to be safe and effective. So yes, they're going to be able to be vaccinated. It's going to be a smaller dose and it's going to be as effective, but we are still waiting, bated breath, but most likely by the end of, according to CDC and NIH, most likely by the end of October, we should be rolling out those vaccines.
Outstanding. Dr. Reed, please, we've heard from the concept of these kids, but tell us what you're seeing. Just make sure you come off mute. And again, let me just remind everybody, don't let the red and white fool you. She's representing the AKA. Dr. Reed, please.
All right. So from my standpoint, I'm a family practice physician. I take care of everyone from birth all the way to geriatrics. So big range, big problems, little problems. Just like Dr. Yolanda said, the little problems as far as the children, they're the innocent ones. Because yes, if you're under the age of 11, you're not able right now to get vaccinated. So what I try and focus on is the population that are 16 and above, to make sure that they go out and get vaccinated, especially teenagers, because the teenagers, here they are, it's the beginning of the football season. So the kids are playing football. Guess what? No one's on the field with a mask, all up in each other's face. So I'm telling them the importance of making sure that you get vaccinated, because guess what? You don't know anything about the person that you were up in the face with, because everyone talks junk when they're playing sports. So you're up there, you have no idea what they have, who they've been exposed to. So that's the population that I focus on and make sure that they understand the importance of getting vaccinated. Yes, we heard the statistics. We heard what people are saying. Dr. Guyton talked about what some of his relatives are saying. But what I'm hearing in my practice, because we were both at the epicenter of New York, one being on Long Island and the other one being Southeast Queens, patients are actually feeling that they don't want to get vaccinated because they don't want to lose their taste, their smell, or die. So that's why they don't want to get vaccinated. So that takes it to a different level, because there we go with the misinformation. So as a doctor, we're having to spend more time making sure that we're participating in webinars, talking to our patients to give them the true facts. You are less likely to die if you have been vaccinated. You are less likely to be hospitalized if you have been vaccinated. You are less likely to have to go on a ventilator and possibly die if you have been vaccinated. And as far as getting the vaccine, the usual things, say for instance, maybe when you turn 18 years old or 16 years old, or maybe before you started college, you had to have a tetanus. So I'll say, you remember that when you had that tetanus shot in your arm and you was super, super sore and you couldn't move it? That might be one of the reactions that you get when you get a COVID vaccine. You might feel really tired. You might have a fever. You might have chills. You might have body aches. You might have headaches. That's what can happen whenever you take a vaccine, because that's your body's normal response to getting a vaccine. And that is what I like to focus on. And then from there, I'll jump to long COVID effects. But I'm going to toss it back to you so we can move on to hear from Dr. Kathy.
Dr. Reed, phenomenal. And we're going to come back to that vaccination piece. We're going to get the brothers back in here, because right now we're just doing ladies' night. And so we're letting the ladies talk to the ladies. But thank you so much. Dr. Harwick, I mean, from your standpoint, and it just, don't forget that, there you go. Just talk to us, bring it home for us.
Well, I'm going back to Dr. Guyton and Dr. Reed initially. And speaking with my niche, I initially started with younger youths, and I wanted to know exactly why they do what they do, because in college they have this spirit of invincibility that you have to tame. But the smaller individuals, working with Maryland COVID Task Force, I was looking at the stats for today or yesterday, and we had 200 new cases, and that's been the average a day. But we had 7 deaths of children 0 to 19. So that really hits home for me as a grandmother at this point. my grandson is my life, and he doesn't quite have that opportunity yet to get vaccinated. So what is it as a parent or a responsible person that's caring for children do? I need to start teaching these children there should never be a case or a day that they don't see me following the practices. And if they see me following the practices, when they get to school and they become the kindergarten to at least the 9th grade, they'll already have that modeling behavior that we need to have for these children. When I think about Dr. Guyton and reproductive health with my adult patients, I hear that, I don't want my baby getting this chip. Okay. You know what? We put chips in dogs right now, not adults. And sometimes just dispelling the myth. Whereas most of doctors are very, very clinical, I get really intimate with my patients. So usually, and not taking away anything from any of my doctors, but nurses are usually at the bedside. So they hear a lot of the concern and the need of the patient. So with me working in that role, my goal is to pull that piece out of my tots, the younger ones. If you praise them, they'll do better. So as parents, we should all move together to model that behavior. If we're all modeling that behavior, the child, the parent, then we can get the ones in our community, in our churches, in our fraternities or sororities, in our other social settings. We can get those same type of modeling behaviors to bleed off into other pools of people. And I'm going to bring it back to you.
Outstanding. So here's what we're going to do, because there's still so much to talking about and there's never enough time. Let's bring the horseman back and just give it up for Brother Piercy. He's our producer and technician that's making all this happen. And as we bring the horseman back and as we get ready to start our panel discussion, and I think we also have all 4 of the horsemen that's here. So Brother Wonzie, he's been with us so long. We're going to get some feedback from Wonzie as well. I want to start off with a clip. I think most of us have seen it this week. But Brother Piercy, if you could cue up that clip, let that clip be the segue to how we talk about these vaccines.
Hey, what's up? Welcome to The Jump. I'm George Sedano. Ramona Shelburne and Kendrick Perkins will join me here shortly. But first, here's what LeBron James said at Lakers Media Day today about his vaccination status. Let's take a listen.
Have you been vaccinated, and do you feel compelled to send a message to the rest of the country about the importance of vaccinations?
I think when it comes down, for me, I can speak about myself. I think everyone has their own choice to do what they feel is right for themselves and their family and things of that nature. I know that I was very skeptical about it all, but after doing my research and things of that nature, I felt like it was best suited for not only me, but for my family and for my friends. And, and that's why I decided to do it.
So here we go. Here we are from, obviously our youth, everyone looks up to LeBron. Hearing this from an all-star like LeBron, let's just start with, let's just go back in our regular order. Dr. Boykin, your thoughts on comments. Again, remember, we're talking about vaccination and so many people's thoughts on vaccination. We've heard, you've mentioned it. People think that there's chips. So let's talk about this vaccination. Dr. Boykin, start us off, please. You on mute, Dr. Boykin? He's still celebrating from that HU. I mean, go ahead. I won't start that. Go ahead, Dr. Boykin.
Thanks, buddy. Yeah. Well, LeBron had it right. First of all, in this particular forum, we're not here to beat up anybody about their choices because it is a matter of choice. But I would ask everybody to make the right choice, because there's those of us out there, the kids, they can't make a choice for themselves right now because they don't have the opportunity to be vaccinated at this particular point in time. So, I think that vaccines are the way to go. Think about it. If you had not had a tetanus vaccine, when you stepped on that nail or you in that car accident, what would you say then? oh, I ain't getting no vaccine, and you die of botulism or whatever. If it had not been for the polio vaccine, how many people would be dead now? How many people will be crippled now? Third world countries, like a lot of people from the Philippines, and Russia, where polio ran rampant, now have chronic and permanent disabilities for that. So I think it just goes to say that the vaccinations are very important. And having practiced pediatrics for over 30 years, I hear this all the time about, I'm not getting this vaccine. The one that was the most recent one that came out was the HPV vaccine, protected against cervical cancer. Well, the myth that got spread out there, it will make my child promiscuous. How in the heck can a vaccine make a child promiscuous? It's all about how you are reared. What are your thoughts? How did you parent that child? And again, I'm not beating up the parents out here, but it's just the kind of misinformation that gets spread out there about it. Just the idea about you're going to get sterile, you're going to get the disease from the vaccine. Well, first of all, the mRNA vaccines have no part of the virus in them. They have the genetic sequence for creating the spike proteins, but they don't have it in there. So I think we can just dispel that myth first and foremost. I think it was Dr. Yolanda, maybe it was Dr. Michelle that talked about sterility. Well, they actually did a study. And found out that there's no way you're going to be sterile from taking the vaccines. No way, no how. And the other thing that's come up in the news recently is about the vaccines and menstrual periods. Well, there are ongoing studies about that. There's some type of correlation. It's like when we first heard about the TTN afterwards, that it would affect your periods, but it's not permanently. So there are a whole lot of things out there for it. We just got to. Have you lost me?
Excellent. No, we got you. We got you. Let's let Dr. Reed chime in again. Being in charge of the school district, Dr. Reed, please chime in.
Thank you for asking me to chime in, because at dinner time, what are we talking about? We were talking about what was on TV, and we were watching about the NFL players and NBA players and media day. So that's why I always say to my child, and both my sons rather, that your parents are your role models. And you should be watching us, not necessarily what the basketball players or the professional athletes are doing. We are the ones. If you have any questions or concerns, yes, you talk to me. But for some of these children, they don't have that opportunity. So as the school district physician, I go in, I make sure we have the conversations, because I know over the summer when I was doing physicals and I'm asking, okay, did you get your vaccine? Did you get your vaccine? Everybody was saying no. And then I said, well, I got my vaccine, so I need you to put on your mask properly, because I don't need your mask down here. I need you to be up here, because I don't need to get anything from you, even though I've been vaccinated. Oh, you are vaccinated? You're going to be a beautiful zombie, because you know that vaccine is going to turn you into a zombie. And what happened? That was like a whole nother conversation. And then it continued and it continued. And finally, after the third one, I was like, listen, just bring everybody in here so we can just have this one conversation at one time, because I'm repeating myself over and over. But I did find that after we had the conversation, a few of them said they were going to go back to their parents, because their parents were telling them the same thing, because where do they find that information but on social media? And that was a decision that some of them actually said when I saw them on the field that they had been vaccinated. But the one thing that when we were talking about disinformation and misinformation, I like what they did in Charlotte. Don't get vaccinated. They had that truck that was driving around the Panthers game and said, don't get vaccinated. And underneath it said Wilmore Funeral Home with a phone number. And when people called up on that phone number, it was a doctor's office. And of course, the numbers started going up in that particular area right after the game, because people were curious. And when they realized, like, oh, shoot, maybe I should get vaccinated, it was a game changer. That was one thing that worked in their favor. So I'm trying to figure out what to do now here.
Amazing. Dr. Phillips, during your segment, you had talked about the percentages. In your case, your office where you're working 100% fully vaccinated employees, workers. United Airlines has posted that 99% of their employees are vaccinated. They've got a couple exemptions for health, religious reasons, what have you. Talk to us a little bit about more, because it sounded like you wanted to go into that vaccination as it relates to the workers. What people that potentially may be losing their job. And Dr. Guyton, we're going to get you in there as well. Dr. Phillips, go ahead.
Well, I think that, when we talked about COVID in the beginning, we talked about getting sick from COVID. But one of the other things that we discussed with COVID was the ramifications of COVID in your life if you do not take COVID seriously. And unfortunately, we are seeing people that have waited till the last minute. I remember my grandmother and grandfather sort of telling me to do something and giving me a heads up on what would happen down the road if I didn't do it. And now we're seeing all these people. I've gotten probably about 5 or 6 calls over the past week of individuals trying to beat the deadline and finding out and asking which vaccine they should be getting. So I think the fact that it's starting to attach to people's money and their ability to move around, I think that has motivated quite a few people to start taking it seriously. I mean, look at what United Airlines was doing. If you weren't vaccinated, you were going to pay $200 extra each month for health insurance coverage, and you were going to be put on leave until the virus was at an acceptable level if you were to return to work, if you maintained your unvaccinated status. I just want to jump back to that clip you just showed. Charles Barkley said a long time ago that these athletes are not role models for us. And even though we have seen that individuals making 8, 9 figures, 10 figures have resources, they have a team doctor, they have people coming to speak to them, they have all of the information spoon fed to them, but they're still sitting there saying, I've been waiting. And this is really unfortunate because we are seeing that our kids look up to these people. However, each one of them that jump out there and say something that's not the smartest thing to say, I'll leave her nameless, but probably more than a few dudes in Trinidad had their genitalia checked for swelling because of the statement of this particular star in our community. And and I say this even with the being a New Yorker, and I'm not necessarily a Brooklyn fan, but I'd like to see Brooklyn win. And unfortunately, this individual will miss at least half the games. And, we talk about it's a personal choice, but as the initiated, is it a personal choice when you're selfish? When you're not thinking about those around you? When you have all of the resources to find out, but you wait until the last minute. So as my grandmother used to tell me, she said, Jedan, you could either listen to me or feel me. I feel no sympathy for these men that are going to feel it. I couldn't imagine if that individual played on my college team and was doing something that would impact the team, because we would have, as they said back in the day, probably a blanket party, to make him understand the choices and how his choices affect other people. But I'm really disappointed with our people that are put on that level by our society as stars. And unfortunately, they're not living up to the star status that they're given, because the information that they're putting out there does not consider how people listen to them. It does not consider that they have resources. So with that being said, COVID getting real, y'all. So you may not get sick with COVID, but you're going to feel the way that COVID will impact your life if you don't take it seriously.
Dr. Hardwick, the ladies that are on the line, and let's just, get right down to it. There's some ladies that are hearing, we've talked about the myths and we've got to dispel all that stuff. But let's just face it, there's some ladies, I'm hinting at fertility. There's some ladies trying to get pregnant. They want to start families, and they're hearing these things about the vaccines. Why should they take the vaccine? Or what would you say to a young lady who has questions about the vaccine and as it relates to fertility?
Well, first and foremost, when I'm talking to a young lady about fertility, I want to know if they have a significant other. And the reason I want to know if you had a significant other is because I need to know where your heartstrings are. Do you have the significant other? Are you ready to make a choice that now someone else you're responsible for their being? And do you really want to take that step? Is there somebody that you care enough to protect? And then when I find those pieces of information out, then I discuss the vaccine, because it's nothing like a person having COVID and dying before you. Most of these people probably need to actually go through that process. The naysayers, the people who are refusing, because if they actually had the opportunity to see it, they'd be more inclined to get the vaccine. When I talk to this young lady and I'm telling her, do you want to be put in a position where you might leave an innocent child here because you had COVID while you got COVID while you were going back and forth to your appointments? Would you want to have your infant to get COVID? Because they're going to present to me with symptoms. And if I can't find out what it is and can't do a COVID swab right then, they're going to claim it like they've been in Maryland, saying it's RSV. And then when they're actually testing these children, finding out that it's COVID. Do you want to lose that baby after you took all of this time and went through all of these changes to have this infant, and then find out that you're going to lose them and you have to bury them? It's nothing like burying a child. A child should always bury a parent, not a parent bury a child. So when you think about those things, those are the things that I tend to talk about when I really need that parent, that mother, that couple to get the vaccine. And we're talking about reproductive health. You know, the World Health Organization, there's a lot of studies that have gone on that have supported the fact that it is good to get the vaccine prior to pregnancy. But if you get pregnant, please take it, because you can cover yourself and the infant. So those things are very, very important. And education is the key. If you don't know, ask. You know, we come from that school of thought now that we'll find it ourselves. No, ask. Because sometimes you're not going to find it in the same search engines as you've been finding things in. And a lot of time you're going to get a lot of other misinformation.
Outstanding. Dr. Yolanda, I'm just going to give you a warning. I don't want to say set you up, but I'm going to put you on the spot, because what I want you to talk to the people about is the nutritional side. Obviously, you are well versed, you are well experienced, well educated as it relates to nutrition. And my point is, if you could talk about the nutrition, and also what I want to segue with is, some people believe that they don't need to take the vaccine because if they do the nutritional things, that can help and they don't need to take the vaccine. So if you could spend some time with us on the nutritional side, but then why they still need to be, or why they still should be vaccinated.
Well, absolutely. I'm going to answer your question, but I'm going to piggyback real quick on Dr. Kathy, because this is actually a really important topic when you're talking about losing parents in this COVID pandemic. We've been talking about this pandemic. We've been talking about the virus and the vaccine, but what we haven't talked about is the pandemic of orphanage. Many people do not know that so we only make up the Black population about 13.4%. It went down in this year's census. I don't know what happened. There's a mass exodus, but our numbers are going down. But for the children that have been orphaned due to COVID, 20% of those children were Black children. So here we are, 13.4% of the population, 20% of our children are orphaned. And here's the issue. Whereas the average child, when they look at it, about 23% of children that are white, non-Hispanic, are in single-parent homes. 62% of African-American children are in single-parent homes. So if that one parent succumbs to COVID, then that child is left parentless. And then we have children being raised by grandparents. I heard Dr. Kathy say she has her. So 80% of the COVID cases are over age 65, right? They're dying. So we just have to be really, really intentional about understanding how we as parents making these decisions not to vaccinate or to play with this misinformation and disinformation, how it's not just affecting our own children, but it's drastically affecting our community. So nutrition. I do weight loss management, if you will. And it's important to talk about it because there are two things that are the most at risk, those that are most at risk for getting COVID. And that's those with heart disease and those that are obese. So I've had a lot of these conversations. In fact, just this week, I had 3, and I'm a pediatrician, remember, I had 3 patients that were hospitalized, and all 3 of those adolescents were obese with asthma, and they were hospitalized due to COVID. 2 of them were vaccinated. They did well. They were only hospitalized for a couple of days. But the third one, she actually was there for over 2 weeks and ended up with MISC, which is multi-inflammatory syndrome of children. That's a whole nother topic we could get into, but it's an inflammation of the heart, the lungs, the brain, the skin. There's all kinds of organs that can be inflamed due to COVID. So our children and children of color are more likely to get MISC. They're more likely to be hospitalized due to COVID. They're more likely, they're less likely to be vaccinated or get tested regularly. So when it comes to nutrition, though, that is an important thing to talk about, because if obesity is one of the factors that puts you at risk for COVID, then eating well, losing weight, being in good shape prior to COVID is going to help you not just get through COVID, but get through any illness. That's just, the bones of it. However, we're talking a lot about people who understand that there are things that are helpful with your boosting your immune system. I am one who talks about boosting your immune system naturally. Vitamin C, zinc, elderberry. I do IV hydration drips. I give you vitamin B complex, high vitamin C doses, zinc. All of that is great, but that is not going to stop COVID. What it is going to do is help boost your immune system, but there is not one study that says that it's going to stop COVID dead in its tracks. There is a study about plant-based diets that will increase or decrease your risk, increase your ability to fight off COVID or any serious illness, and decrease your risk of getting moderate to severe COVID. But the numbers are something like 73%, something like 59% and 73%. That's not as high as the 99 and 95.9% for a vaccine, right? So whereas you can help yourself and increase and boost your immune system, you are not stopping COVID in its tracks when you face COVID, but you can, just like a mask, just like social distancing, just like washing your hands. These are added layers of protection. But again, the vaccine is something that is also an added layer of protection that is never meant for you not to get COVID, but it's meant to keep you out of the hospital and keep you from dying.
Outstanding. Let's go to these 2 points, and then we're going to hear from Wonzie, and then we're going to get ready to. This is just like our meetings, right? When we're in our organization meetings, there's always great stuff to talk about, but it's just always seemed that we're running out of time. I want to talk about, I believe Dr. Boykin mentioned this emergency use for our ages 5 to 12. So. Dr. Reed, let's go back to you. So school districts. So what do you say to a parent of that kindergartner or that first grade that says, wow, now they want to put a vaccine in my 5-year-old that it's just been around? Again, we're going back to what we started the first time, even for us as adults, as it relates to this vaccine. But what do you say to that parent that's in kindergarten or first grade about the opportunity for a vaccine for their child?
So that's an excellent question. And I can sort of relate to that only from the standpoint is, and I'm not trying to tell my age or anything like that, but I remember I did not receive the hepatitis B vaccine when I was growing up. because it wasn't offered then. But by the time I finished college, it was being offered. And I explained to the parent, you know what? Wasn't that long ago. You didn't get it. I didn't get it. But your child, before your child left the hospital, really right as soon as the child was born, that child received the hepatitis B vaccine. Are you serious? I'm like, yeah. If you look at the records, it has the same birth date as your child. So when you talk about things being new and things like that, when I was growing up, there was no cell phones. By the time I was in med school, the cell phone was about the size of a suitcase or a little bag. And now it's the size of this. So things change, and we're a society where things are rapidly changing. And I just want to piggyback off of what Dr. Kathy and Dr. Yolanda said. Nutrition is key, but as far as with me, my story was I ended up with COVID in March of 2020. And to fast forward to now, when we talk about those long COVID effects, every now and then, I still get a little short of breath. And this is the body that ran 3 marathons. That's 26.2 miles. I could barely run a mile or 2 without stopping. Every now and then, my heart still races. And it's not racing because it's anxiety or depression. It's racing because that virus attacked my body. And my doctors tell me, because now I have to see a pulmonologist, because the pulmonologist put me on the steroid inhaler and gave me albuterol. I had no asthma. We have no family history of asthma, but I know it was that virus. And when I say that what happened to me and personalize it like that, people are like, oh, shoot, you were in good shape. You're fit, doc. Yep. And that is what saved my life. My cardiologist, because now I have to see a cardiologist, told me that. My primary care doctor told me that, who was my classmate. And the pulmonologist, they said, if you hadn't taken care of yourself the way you did, what you were eating, I'm not plant-based, but for the most part, I'm a pescatarian. Every now and then I have to have a little bacon, some beef. But if I hadn't done those things, they said, no telling what would have happened to you. The sheer fact that you took care of yourself. And Jedan knows, Dr. Phillips, I videotaped everything I went through when I had COVID. And on Easter Sunday in 2020, this was me on the cover of my regional newspaper. My last video that the newspaper submitted is now up for a New York Emmy next month. We have to share our story. We have to continue having webinars like this, because this is the only way that we're going to get the information out to people who are going to spread it to their friends and their family.
Outstanding. Outstanding. Dr. Guyton, please hit us again about dispelling the rumors.
So one of the main things I want to keep pushing is we go to those trusted sites. The SG put out his report on misinformation, which has some great tools and suggestions on how we can work within our communities, our fraternities, our sororities, and our churches, those trusted assets to dispel the rumors, how we can make sure that our social media platforms are reporting accurate information and are accountable, how we can continue to educate our kids, our communities on how to deal with the disinformation and misinformation. People are 70% more likely to hear negative information and believe it the first time around as they will believe the truth at this time from social media. That's how bad we are right now. So please continue to use those trusted sites and continue to push people to those trusted sites. I would say when they bring you those crazy questions or they bring you that misinformation, listen first, meet them where they are, and then you sit back and you educate. You don't direct, you educate. You try to bring them to a level of understanding and a level of comfort to get them where they are. As a counselor, many medication counseling sessions, I've had to convince people, hey, this pill ain't gonna kill you. Well, this will kill you, and it's called you not believing in the truth. So let's work on getting you the truth pill. Let's get that in you. I want to make sure Wonzie has opportunity to speak because I haven't seen my brother in a while.
Yeah,
I'll stop there.
Absolutely. It's always good to see, and that's perfect segue. Our fourth horseman that's joined us tonight, Brother Wonzie Gardner. He works He's a federal emergency official. We'll just leave it at that. Always brings us some information from our government. Brother Gardner, it's so good to see you. Just make sure you come off mic, my good brother, off mute, and the floor is yours.
My brothers and my sisters, good afternoon. I realize I'm in tall cotton, and Mama told me a long time ago, when you're in tall cotton, sometimes you just be quiet. And you guys have put on a show of shows tonight, and it really represents what we are and who we are. The problem is the people that need to hear this and understand this are not on this webinar, and that's that part we're missing. What I want to talk about this afternoon was what I think Brother Guyton hit it earlier. We've now come a point in our society, in our time, where not only the COVID is killing people and destroying families, it's now destroying lives from a financial standpoint. As you all know, the government mandated November 22nd is a day that all federal employees must be vaccinated. I think Brother Guyton mentioned the fact that today United Airlines terminated 563 people. There are other companies that are lined up too. This thing is so serious that if we don't take care of it, it's going to destroy us as a society. My biggest concern when I sit on the COVID ops thing with the White House, stuff like that, is to see how this is impacting Black people. The reason I was late tonight was the fact that we're trying to work through this shutdown thing they're working through, without going into details. But here's the message I wanted people to understand tonight. We've gone to the point from we're educated, we've told people what's happening with COVID, and you will die. And we've got to the point where we're numb now. And if it doesn't hit you personally, it doesn't exist because it's been all around us. But we can't let our guard down, because now we're going to what they call the dark winter, where we're still trying to get emergency use authorization for kids. I don't want to talk anything about science or doctors. I'm not one. But I do look at it from a social standpoint of trying to protect the most vulnerable, which are our kids. And we talked about being selfish. I was one of those people at one time talked about most people that weren't vaccinated were the anti-vaxxers. That's not true. There are a lot of people out there who, whether they misinformation or whatever, there's not a level of trust in what we do. The problem with that, though, is that level of mistrust is killing our community. And I'm surprised, and Cedric talked about that earlier, the numbers in our community that are being impacted. And one of the doctors talked about the single family home with one child. And so every day when I sit and watch the numbers at my level, it's staggering, it's scary, it's disheartening, and it's humiliating to think that in 2021, a group of enlightened people who've been through everything and have an opportunity to get things we need won't do that. And so my message today is you all keep doing what you're doing as doctors, as those on the front line. We appreciate you. We applaud you. Recognize for those who are listening that we're getting to the point now, as Dr. Guyton talked about, you're going to have an ID card at some point in time that says whether you've been vaccinated or not, because COVID is going to be here with us. And now it's getting to the point now that if you're not vaccinated, you may not be employable. Again, if you're not vaccinated, you may not be employable. And if you're not employable, there's nothing you can do for your family. There's nothing you can do for your family. And so as a father and as a mother and as a brother and sister, and as a person in the community, it's our duty to do those things that are good, that are just, and that are decent. And I said before, there are a lot of people that don't understand, and a lot of people have a lot of misgivings, and they're not bad people. They just have not been reached at the right point. And so as one of my sisters said earlier, I applaud this, and I applaud you all for what you're doing, because you're on the real front line. I sit back and do the numbers and put out all the messages and everything. And the message is this: if we don't do this together, we'll fall together. If we don't take a united effort together, we won't beat this thing, because COVID is beating us right now. I just got off a phone with my esteemed school, Tennessee State University, and we're trying to figure out whether or not we're going to have homecoming or not. And I asked one of the brothers on the call today is it so important that we take a sacrifice today so that we can rejoice tomorrow? And so I leave you with that. And I like I said, I'm in tall cotton. I can't speak tonight because I got all this power, all these doctors here. So brother, and both of my other horsemen, I thank you for just let me have a little snippet of a corner of what you all do tonight. God bless you all.
No, we appreciate you. Let's like I said, it's always this time thing. But look, we're gonna go there. We're gonna stay on because this information is important, and people need to understand. So it looks like we have a question here. Please also address the benefits on monoclonal antibodies infusion as outpatient for those who test positive with mild symptom and have been vaccinated. Some physicians are not offering treatment in their offices. Some hospitals are offering this as outpatient, free in clinics. Anybody want to take that?
Well, I'll start off a little bit.
right.
Monoclonal antibodies, there have only been 3 that have been approved in certain situations. Monoclonal antibodies are not the cure-all, do-all for everything. They have specific indications for those, and they are to be given as an outpatient situation, as an infusion, with the ability to resuscitate anybody if you have a serious reaction to it, such as anaphylaxis. So it's not as innocent as they say. And the doctor's probably not going to give it to you in his office if he doesn't have the ability to resuscitate you. He doesn't have the emergency equipment. So he or she is within their right not to offer you monoclonal antibody if they can't support consequences thereof given them. So I just ran across today. I did not write them down, but if there are 2 that are given for mild to moderate disease, so that you won't. The whole idea with the monoclonal antibodies is to prevent you from progressing to severe disease. So with mild to moderate disease is when they want to give it. There is a time factor. I did write it down. I forgot what. Maybe Dr. Phillips can talk about the time factor, or any of the other physicians can talk about the time factor. But the monoclonal antibodies have specific indications as outpatients with certain situations of emergency resuscitation. So it's not just something you walk in and say, "Doctor, I want to," like you're gonna get a pill. It's not like that. So
I'm gonna jump in there and help you out, 78. Again, you were right about the monoclonal antibodies being a support. It's actually used to help support your immune system for individuals that are diagnosed with COVID and have risk factors for COVID being much more severe. So it is preferred to be used within the first 2 to 3 days after you have been diagnosed. It says up to 7 to 10 days, but the later you use it, the less effective it is. Unfortunately, it was something that wasn't common knowledge earlier on in the pandemic. So a lot of people, especially from communities like ours, did not have access or weren't even aware to ask for it. Unfortunately, that case still seems to be the circumstance as far as a lot of people from our community not being aware of it. If I have a person that comes in, they may have been vaccinated, say they're overweight, say they're asthmatic, say they have heart disease, and they've been diagnosed with COVID, and I'm concerned that it may get bad for them, I can fill out some paperwork and they go to an infusion site that is able to manage any potential side effects, and that's where the therapy is provided. In some spaces, they're not providing it. I think Tennessee or Kentucky were states where they're not going to give it to people that are vaccinated and trying to reserve it for individuals that are not vaccinated. The rationale being is that the non-vaccinated individuals would have possibly a more severe presentation of COVID. So that's a little bit I wanted to add to what Dr. Boykin was saying about the monoclonal antibodies.
Brother Pofo, I'll add one more thing. And on the federal aspect, it's one of the main alternatives now because some states are not pushing vaccinations and they're building monoclonal antibody clinics. But what we're looking at is a shortage of care providers that can provide that infusion because you have to be in a secure area. You have to have a paramedic near or someone who can do CPR. And that means not every provider can do it or infuse it. As you know, a number of providers can give vaccinations, but now you're looking at a more educated, a more higher level provider that can do it. And I'll let one of the doctors speak.
well,
I was going to add too for our situation. So you can go into most times urgent care or an emergency room, but we would usually we would refer a patient to do that. And I just want to stress again, one of the things that Dr. Phillips said, those people that are at risk are those that are obese, those who have respiratory diseases. But again, our community should know about it, because sickle cell counts, somebody with something like a sickle cell that might go into crisis because of their because of COVID. Other things are heart disease. So there are plenty of reasons that diabetes. So there are plenty of reasons that our community should know about monoclonal antibodies and have access to it. But again, if we see or think that you need it, we would most likely send you to an urgent care or an emergency room. And for Children's National Medical Center, we do it in our emergency room setting, but in sort of the urgent care side.
I just wanted to add to that, just so people are clear, it's not just related to adults. Anybody that's over the age of 12 and weighs at least, I believe it's 40 kilograms, greater than 40 kilograms can receive the monoclonal antibodies. So if you have someone in that age group, in that capacity, then you can refer them to the center to get the monoclonal antibodies. And pregnancy is also considered a high risk. And the biggest one on the thing from the pediatrics aspect, as Dr. Yolanda said, is the obesity. And you have to be, I think, greater than the 85th percentile for your body mass index to qualify for that. Diabetes, sickle cell, kidney disease, all those things are reasons why you want to get the monoclonal antibodies. I had to tickle my brain a little bit to bring some of that stuff back. When you get to be a 78 brother, those things happen to you. So
that's all good. To the doctors, people that have already had COVID, not vaccinated, should they get vaccinated?
Everybody should be vaccinated, even if you have not had COVID, even if you did have COVID. The antibodies that your body produces from the vaccine are a lot stronger than what you would get from your natural immunity from having the COVID infection. There are some studies out there where patients after 7-8 months still have antibodies to COVID, but you get more protection from the antibodies that your body produces from the vaccine. That is proven. I even have like a patient who she still has not been vaccinated. She had COVID same time I did, March of 2020. She's like, I know I still have antibodies. I just don't. But you know what? We can't force everybody, but all we can do is just continue, and we just use it as an opportunity to continue to educate her, to continue to encourage her. And then also talk, like I said, about the long COVID effects, because I have some patients who have chronic headaches. They can't even return back to work, so they're on disability. People who've lost their hearing, people who have intermittent periods of blindness, difficulty walking because it has affected their nervous system and their muscles. So those are the things that we also talk about and use it as an opportunity to say, well, you know what, you didn't get it, but this can possibly happen as an effect of the disease. So let's think about everything. Let's look at the whole big picture of everything that's going on.
But what's important too, though, is that if you got COVID early, say you got the original COVID, right? And you have your antibodies that you produced are more toward the original. Remember, it's the vaccine that's most protective against all of these other variants. So the Alpha variant, the Delta variant, and what you have and what you've produced in your natural immunity is not the same as what you're going to produce as a result to the vaccine. So it's very important to understand thinking that, oh, I already had COVID, so I'm protected, is not very smart, especially if you got COVID very early and you think you're protected against the Delta variant. Not so.
Dr. Hardwick, let me ask you, just because, Morgan State, Coppin State, and I think between Brother Gardner and Brother Guyton, they've already mentioned it, homecoming season, right? So guess what? I'm vaccinated. I'm going back to homecoming. I'm going to have a good time, and I'm vaccinated. Do I got to wear a mask?
You most definitely have to wear a mask. Most definitely. I work at Goucher College, and they have NCAA games in just about everything. I find that after a good game with Towson State University or another team, I get hordes of students at a time to get tested. Now, for me, in a PWI, a predominantly white institution. If I have the students coming like that to get checked and tested, where are the people that look like me? I really, this is what I need. I'm looking at it on the converse end, but I definitely need you to come. I definitely need you to stay protected. It is homecoming season. You might not wear clothes, but please wear a mask. And you all know what I mean. Every party is going on. You have everyone on campus. Everybody's in their best dressed or unless dressed. But make sure you're protecting yourself, wearing a mask, trying to stay as socially distanced as you can, which is almost impossible at a game. You can't even do 3 feet most of the time. So my encouragement is to wear your mask, continue social distancing, get handy wipes. You don't have to wash your hands. Get handy wipes. Put a pack in your pocket. And every time you touch something new, you can do it yourself. So I do think that you all have, done wonderful tonight with trying to reach every age group.
Yeah, we definitely we may have to reconvene. There's a question there. I don't know between brother Wonzie, between brother Guyton. Maybe y'all want to flip a coin, or maybe y'all both want to chime in. With the rising cases of COVID-19
So,
among
bruh,
teenagers.
brother Dr. This is
Yeah.
my chapter, brother Dr. Eddie Black, who was
Oh,
on
okay.
MSNBC and got interviewed. So,
Okay.
brother Black, I think that's dog. Brother, what we have seen in some HBCUs, I'll use Alabama State as one. There have already been stringent COVID guidelines in place. Colleges and universities were ahead of the curve and they're not playing. If you are not tested, if you're not vaccinated, they're sending you home if you get sick. They're not allowing you to be on campus. If you're a vendor and you're interacting and working with the college, some universities are requiring you to be vaccinated. So the college and university or universities, most of the public ones, are ahead of the curve. What we're worried about is the high schoolers and the teenagers. Those school districts are not as forceful, and they have more of a, pushback from the communities. But when it comes to colleges and universities, state schools with endowments, they've already put protocols in place. They're not going to lose that funding again this year. Our worry is going to be getting our families involved in the communities and getting them to those school board meetings to shut down the loud minority that's screaming and hollering and threatening doctors and nurses and our school board members. That is what we can do to ensure that doesn't happen. Brother Gardner.
Brother Info, I don't know if you all saw on the news where Nashville, Tennessee was the epicenter of stupidness, where people were challenging this sister who was a pediatrician in Nashville, shouted her down, and then her and another doctor went to their car, and when they were accosted, my wife knows her personally, and she's an AKA in 81. But anyway, the problem we're having, and let's talk about our community. When we party, we party. We don't do that socially distanced kind of things. We have the suites where the fraternity and sororities have their own thing. We have libations. We have the big party, and it is a recipe for disaster. And as I said earlier, nobody wants to say we need to cancel anything. Nobody wants to do that. But if we want to think about tomorrow, we have to do some smart things today. Again, if we want to think about tomorrow, we have to do some smart things today. I think Prairie View and A&M was one of the first colleges I heard about that canceled homecoming. They're having a virtual homecoming. That takes strength to do something like that. Because as I was talking to some people at Tennessee State earlier, there are political dynamics too. If you're in a red state where you have a governor and 2 senators saying that everything's okay and you're state funded, there are things that you can't do things normally, and I'm trying to walk real gently here. And so there are other dynamics at play. So what we've got to do is we've got to make sure that we do all the right protocols, temperature testing, washing of hands, signage, and all those different kind of things. But the bottom line, it's a personal choice. I'm going to homecoming, but I'm going to be in a room, and I'm going to see my family. But it's tough. And I wish there was a way that we could wish this way. We can't. And so my big fear, as Brother Guy talked about, is an epic outbreak at one of our institutions. And the first thing you're going to say, see, there they go again. and we're the most vulnerable, okay? And we're the last ones they're going to come rescue. We're the last ones going to get triaged. We're the last ones we're going to get those big dollars coming to save us. Brother Guyton talked about the mandates and the things they're doing already. But what keeps me up at night is what happens to us, because we're the last ones to get what we need to make us right again. Thank you.
Outstanding. Here we are. We've reached a point where we're going to do our 1 minute closing statement. This is your opportunity for your message to those that are watching, those that are listening. What message? If they didn't hear anything on tonight, your final message as we prepare to depart. We're going to start off with the ladies first. So we're going to start off with Dr. Kathy Harwick. Thank you so much for joining us tonight. And please, your closing remarks.
My closing remark is just walk the walk, talk the talk, and involve everyone in your community to ride with you. Get your tribe together and move forward.
Thank you so much for joining us. Dr. Reed.
The pain in the arm, the fatigue, the myalgia, the headache, the fever, the swelling, mild compared to the disease, hospitalization, ventilation, and death. What more can we say? What more can you do? We'll just keep having the conversation and encouraging and listening.
Outstanding. Dr. Yolanda.
I will say that our most vulnerable, our most precious commodities besides ourselves are our children. And I think it's extremely important that we consider understanding that we're the adults in the room. So getting vaccinated, as a pediatrician, you bring babies and they brave through these exams every day. 2-month-olds, 4-month-olds, 6-month-olds, 18-month-olds, 4-year-olds that don't want to get a shot. And guess what? They get the shot. We're very proud of them, and they walk away and they're proud of themselves. But right now, the reason many of our kids aren't is because our parents have decided they don't want to be the big kids in the room and they don't want to get these shots. So the only way we can protect the children that cannot get vaccinated just yet is if we are vaccinated, and if we show the attitude that being vaccinated is the grown-up thing to do, then I think it is vitally important and essential. And I think we can get through this, but we have to protect those that cannot protect themselves. So think about the children.
Thank you so much. Dr. Boykin.
Well, these ladies did some wonderful summations for me. And I will tell you that Dr. Yolanda kind of stole my line, because my thought is that, don't be selfish. You have the little ones out there who cannot make the choice. It's your personal choice whether or not you get vaccinated, but they don't have a choice to make, because they're looking up to you for guidance. They're looking up to you for protection. If a child can get 6 injections of a vaccine and survive, why the heck do you think one single COVID-19 vaccine is going to do all that harm? I have personally seen children get 6 vaccines. I had a limit when I was practicing that I wouldn't give so many, but I've seen them get 6, maybe sometimes even more than that, as catch-up vaccines. These children are very well. They do very well with vaccinations. So don't let the misinformation cause you to lose your child. Don't let the misinformation cause your child to bring in disease into your home, maybe affect some older members of your house that's not vaccinated. Do your thing, get vaccinated. If you're going to go to homecoming, I know a lot of you are. I went to the Howard Hampton game, which I consider my homecoming. Wear your mask. Do the right thing. Wash your hands and do social distancing. Most of the colleges that I know of are doing modified homecomings. If that's your choice, do that. But follow their guidelines. Don't try to bend the rules, because every time you bend the rule, that might be more cases of COVID-19 than you can ever imagine. So think about that. And by all means, please get your flu shot. It's very important to get that. And you can get it on the same day your COVID-19 vaccine. So with that, Brother DR, I yield.
Thank you so much, Dr. Boykin. 88, Dr. Phillips.
All right. Well, again, it was an honor to be part of this esteemed example of Black medical excellence tonight and getting out this important message. as I said in my remarks earlier, we are at the same point last year that led into the worst winter that we've had. And if we, as Dr. Hardwick said, don't get with the program, we are not going to see the light, at the end of the tunnel. We're going to stay in the darkness. So with that being said, we've got to, because we're not going to be able to booster ourselves out of this. We're not going to be able to monoclonal antibody ourselves out of this. The real thing that we've got to do is we've got to get vaccinated. And it's not just for us. It's for those that are vulnerable, and it's for the future. So with that being said, man, y'all got to get on the program, y'all, because if we don't, then this will be as bad or if not worse than what we saw last winter. So with that being said, I thank you for my time.
Thank you so much, Dr. Phillips. Brother Gardner. You're on mute, my brother.
Dr. King once said that the ultimate measure of a man or a woman is not where they stand during times of comfort and convenience, but where they stand during times of controversy and challenge. These are controversial and challenging times. If not us, then who? And if not now, then when? We've got to take a stand. Thank you.
Thank you so much, Brother Wonzie. 91.
Again, I want to thank you, Brother DR, for allowing me to continue to be a part of this esteemed panel. I'll close with this, 31.6%. That is not going to cut it. We have to do better. We can do better, and we will do better if we're going to survive and protect our kids. This is a no joke scenario. COVID will kill you if you get it. COVID can live in your life forever if you get it. The vaccine will protect you. Very simple. We got to do better. We will do better, and we can do better.
Thank you so much, 91. I think, I know we said the last comments. I see a question there. And Piercy, I might be messing you up because you got everybody ready to close. I see a question here. What happened to J&J clients? Let's see if my guess is from that question, they're asking if they got the J&J shot initially, what booster options are there for J&J? I'm going to guess that's what they're talking about. Can we see if either, there you go, Dr. Reed.
So right now they're talking about it's in the works for Johnson & Johnson or Janssen vaccine along with Moderna. They are working on getting the booster for that. No one has forgotten J&J. It's still there, just waiting for the numbers and everything to be reviewed. So we don't want to say anything ill about that vaccine. That is still an option.
Yeah. Or I guess Moderna's in the same situation since there's only a booster
for Pfizer. Yes.
Right. Okay. Dr. Boykin, do you want to chime in on that quickly?
Well, I was just going to say, as you said, the only approved booster right now is the Pfizer one. But Moderna and Johnson & Johnson have both have their data gathered. Just a matter of submitting it for review. And particularly when the third dose came out, J&J did not have any information, but the CDC said there was no reason to think that it wouldn't work for those people that were immunocompromised. They just didn't have the information. But now the Johnson & Johnson or the Janssen vaccine has done their work, done their studies, and they're submitting their data. So again, the booster shot is just that, Pfizer, 6 months after your second one, you have to be fully vaccinated. And the third dose is 28 days after your second dose if you're immunocompromised. Let's get that clear. Third dose does not mean booster. Third dose just means an added dose for those immunocompromised people. I don't have the information in front of me what percentage of African Americans are fully vaccinated, but if you go to the CDC's website and look on the COVID-19 data tracker, they break it down by age and ethnicity. So you can find out exactly what percentage of African American people are vaccinated. So that information is fully available to anybody who wants to look it up.
Outstanding. All right. Well, let me thank all of you. I know the horsemen, they do this many times, many different places. But let me just thank you personally, as always. And let me thank our female doctors who came on. What a pleasure. what an honor to have you sharing from the ladies' perspective. I know that the ladies were very appreciative, and I believe that we're going to have to do this again. So thank all of you. So to everyone that joined us tonight, on behalf of our 41st Grand Bacillus, Dr. David E. Marion, who leads this awesome fraternity, we certainly thank him for his leadership. The brothers of the Mighty Second District, all 5 states from New York to New Jersey to Pennsylvania, Delaware, and Maryland. Certainly, brothers have been in this for 21 months. We certainly want to thank all of them. As I always do, I remind you, please take the time and donate blood. It's so critical. It's very important that we make sure so much good comes out from the opportunity of potentially saving a life. So please take the time, register, and donate blood. I want to thank our producers, certainly Brother Piercy, Brother Ed Hill, and Brother Tim Worley, working behind the scenes to make sure that we're able to give this information to you. Last and certainly not least, would you help me celebrate? Today is my mother's birthday. She's been on this whole time. So, Mom, I want to say to you, happy birthday. I love you and thank you for all that you've done. With that, everyone, have a wonderful, wonderful, and safe evening. But most importantly, stay safe, stay blessed. Brother Kelvin and Pofo. We'll see you next month.